My name is Dr. Faisal Siddiqui, and I am one of the vein specialists here at our vein treatment clinic. Today, I will be answering questions about VenaSeal closure systems for our patients as well as for people interested in this procedure. VenaSeal, also known as vein glue, is a safe, unique, and minimally invasive medical adhesive used to treat varicose veins quickly and effectively. It can be used for the permanent treatment of varicose veins that are close to the surface of the skin. The vein glue is the best way of closing the main vein of the leg that causes varicose veins, usually either the small saphenous vein, the great saphenous vein, or a combination of both. To begin, we first utilize ultrasound to examine the leg. Following this examination, we perform a small injection of local anesthesia. Once the appropriate anesthesia is achieved, we use the ultrasound machine to guide a very small needle into the vein. This is then transitioned into a larger sheet you can see here with orange cap and white base, which will allow access into the blood vessel that needs to be treated. The blue catheter is introduced into the blood vessel, and we use a combination of ultrasound and feel to be able to identify the blue catheter going into the varicose vein. After drawing the adhesive to the syringe, we can then interface it into the dedicated catheter, which is the long narrow tube used for injection into the vein. The catheter is then attached to an injection gun, which will allow us to slowly administer small amounts of the VenaSeal adhesive into the blood vessel. Under our controlled environment, we then start injecting small amounts of the glue, pull back gently on the catheter, and literally compress the vein as we go along. When compressing the vessels together, they get glued and we go through the course of the vein. As we approach completion, we then pull back on the white sheet out of the body, and we then deploy a small amount of glue to the last parts until the catheter is out. You are left with a small nick that heals quickly, and we apply small bandages. The entire treatment procedure takes 20 to 25 minutes, depending on the condition of the vein. What is VenaSeal made of? The VenaSeal glue is made of a substance called cyanoacrylate. Cyanoacrylate is a clear and free-flowing liquid that is safe and sterile for injection into the vein. It is carefully formulated in modern labs and has some unique medicinal properties when compared to the other glues on the market. This substance has been used for years within the medical community as a strong and trusted adhesive that is harmless to the body. Am I a candidate for VenaSeal treatment? VenaSeal treatment is meant for both men and women with large and painful varicose veins. It is highly recommended that every patient should go through a thorough evaluation before treatment. This is to determine if VenaSeal treatment is the best option for their needs or another treatment method is more ideal. When can I return to normal activity? The VenaSeal treatment is uniquely designed to reduce recovery time. Most patients return to normal activity immediately after the procedure. Your vein specialist can help you determine when you will return to normal activity. What happens to the VenaSeal treatment adhesive? Only a very small amount of VenaSeal adhesive is used in closing the vein. With time, your body will naturally absorb the adhesive. That's all for today. We hope you find our resources helpful in better understanding your vein disease treatment options. And don't forget, you can ask our team of vein specialists any questions in our comment section.